Hi, welcome back to the second video in this series regarding proning patients in the intensive care setting. So we've got exactly the same patient here, but this proning video is going to focus on someone who has a higher BMI. Now this isn't going to be applicable for everyone with a high BMI. However, the main differences here is that we're going to use the hoist in order to lift them up, and we're going to use something called the Montreal mattress in order to prone them and position them safely and effectively. We're going to assume we've done exactly the same preparation as we did before with the other patient. So we're going to start off with a timeout. So do we have a minimum of 5 people and one for the chest strain?
Yes, we do.
Fantastic. It's also good to note at this point that if the patient does have a really high BMI, then more hands to help turn the patient would be really advantageous. Are all team members aware of their tasks?
Yes.
Has pre-oxygenation been performed?
Yes, it was for 5 minutes, 100% of oxygen.
Super. And do we have cardiovascular stability?
Yes, she had been stable for the last hour.
Do we have an adequate sedation of a RASS of -5?
Yes, we do.
Super. And have we given muscle relaxant?
Yes, we are giving now, and infusion is set to go.
Fantastic. So if we're using the Montreal mattress, do we have that available?
Yes.
Lovely. However, if the patient, if we don't think the patient's going to fit on the Montreal mattress, then we can still use pillows, but they would be arranged differently dependent on the patient's body habitus. And is the team leader familiar with the procedure?
I am.
Super. Right, we will begin.
Okay. So the first step will be to roll the patient in order to position the repose sheet and the sliding sheets.
Ready? Steady. Okay. Ready? Steady. Roll. Ready? Steady. Roll. Ready? Steady. Roll. Ready? Steady. Roll.
So next we are going to apply the sheet on top of the patient, so that after the turning patient there will be a sheet between the repose mattress and the patient. So now we are coming to the point when we are going to turn the patient. So the first step is to slide the patient towards the edge of the bed, away from the ventilator.
Ready? Steady. Slide. Ready? Steady. Roll. Ready? Steady. Roll.
From this point, the anaesthetist supports the head and EP tube all the time, because the final support for head is not applied till the patient is in a final position after hoisting. So the next step is to remove the sliding sheet. And now it is time to hoist the patient. The hoisting loops are used at the level of the red mark, which makes them shorter, and the position will be more stable when the patient is lifted up. And the top loops we don't use because it makes very difficult to keep the head in an acceptable position when the patient is hoisted. So if we feel we are ready and safe, we can slowly lift the patient and observe if position remains safe and if our lines are all safe and reaching the height which we need. Okay?
Going up.
And anaesthetist supports the head all the time. Now we position the pillow and additional supports which we may need. For example, the support bushings, which will take off the pressure from the knees.
Happy with your position?
I am happier.
Can I lower the patient now?
And this step is done very slowly and carefully, assessing very exactly the patient's chin, chest, abdomen lies on the pillow. We may need to lift the patient again and readjust again.
Can you go up again?
Going up.
You ready?
I think yeah.
Can I just check how we are? We go up
Okay.
slightly again.
Okay.
Okay. I think it's okay now. Maybe this way.
A little bit.
Okay.
Yeah.
And we go down again.
Going down now?
Yeah.
Also, team leader observes all the time the vital parameters.
Just take the hoist back.
So exactly the same as the sign out from before. I'm going to go through the same questions again and ask the team whether they're happy. So is your endotracheal tube length at the teeth and capnography is present?
Yes, it is.
Super. Is your monitoring been re-established?
Yes.
Super. Have your ventilator settings been reviewed?
Yes. They can.
Excellent. Are the lines patent and secure?
Yes.
Super. Is the chest drain below the patient and unclamped? Now we need to check the pressure areas again. So is the endotracheal tube not pressing against the lips?
No. No.
Super. And there's no pressure on the eyes or the nose?
No.
The ears are not bent over?
No.
And there are no lines or cables resting against the patient's skin?
No.
Is the abdomen maximally free?
Yeah.
And the genitalia aren't being compressed too much?
No.
Okay. And the pressure relieving devices have been positioned correctly? Everyone happy with that? Super. So the only difference between this and the first method is that we don't need to remove the slide sheets anymore. However, we do need to position the patient in a reverse Trendelenburg at 30 degrees. Perfect. The nasogastric tube position is confirmed and it's secure.
Yes, it is.
Wonderful. And the post-proning care checklist is available.
Yes.
Fantastic. Are there any immediate signs of intolerance of this prone position?
No, she's doing all right.
Fantastic. So this concludes the second part of the proning method using the hoist for larger BMI patients. And exactly the same scenarios with regard to resuscitation apply as the first case.